Hi, my name is Callie Dirks, and I am here representing the Patients for Affordable Drugs Committee. I am a nurse, and I'm here to express my support of an act relative to patient financial protection. So, this act will help to lower out-of-pocket costs for prescription drugs for patients of all insurance types for any kind of protection, for any kind of insurance protection. So, this is really helpful because it will help patients who are unable to afford their prescription drugs. So most Americans have stated in 2026, in a study done by KFF, that they feel as though it is difficult for them to afford the prescription drugs. It has led to some of those Americans either having to skip filling the prescription drugs, skip days of taking them, split them in half, or find other ways to have cost-effective care. This also has led to issues with providers and pharmacists. Providers now feel as though they were responsible for finding the most cost-effective drug rather than finding the best drug for the patient. Pharmacists are also responsible now. Patients often will go to the pharmacist and ask them, "Hey, is there a drug that's more cost effective instead of taking this one?" And then pharmacists will then have to go through the database and find, a more cost-effective drug. And sometimes this could not be a hassle for them, but also they're serving many, many patients, and it can, increase amounts of time that they're spending with each individual, which they really just don't have the resources for. This is also a complaint of providers. Some providers feel as though they're not prepared to be able to take this part of caring for patients on just because they don't have the resources in order to find which medications are more cost effective based on which insurance because every insurance is different. And as a nurse, I have seen, how this has affected my patients. I've seen firsthand, people not being able to afford their medications, not taking them, not being able to afford them for their children. I've seen so many inhalers not be filled for their children. Um, and so I really hope that you take this law into consideration based on how many Americans it affects. And I hope that we are able to pass a law like this in order to help Americans afford their drugs. So thank you for listening and taking this into consideration when approving um, this law.